one of them, this is one of the more fascinating pieces that I've seen today. This is over at truthout.org. It's by Wendell Potter, our old friend. Wendell's a regular on the program. He used to be a senior executive with Aetna. He was vice president of marketing, as I recall. And finally just said, to hell with this, or to heck with this, pardon my language. And, we're going to, I want to do something better with my life. And he's got some really great projects going on right now, the Tarbell thing and whatnot. We'll get him back on the program to talk about this. But he points out polls show that a growing number of Americans are warming up to the idea of single-payer health care. And what is most relevant, he says, what is relevant is that most of us have lost faith in private health insurers and want the government to do more. And then he's looking at this poll from June. They just, the results, Pew Center did, crunch the numbers and all that sort of thing. 60% of those surveyed said the federal government has the responsibility to provide coverage to all Americans. 60%. And he says, we've seen similar results in years past. He says, as a former head of corporate communications for the global health insurance company Cigna, I said Aetna, it was Cigna, I'm sorry. He says, I saw surveys on a regular basis that consistently showed a sizable percentage of Americans held private health insurance companies in very low regard and would be happy not to have to deal with them. And in fact, only 19% of Americans, this was back in 2007, viewed health insurance companies favorably. And the same poll showed 77% of Americans thought Congress should, quote, do something about the unreasonable cost of health insurance and other health care services. More people favored a Canadian-style health care system than any other potential solution. And that's the sort of thing that's moving in this direction. And now you've got, the chairman of Berkshire Hathaway, Warren Buffett, coming out and pointing out that a single-payer system, he calls medical costs. I mean, this is remarkable. And keep in mind, Toyota relocated a factory or located a factory in Canada because they found that having it in the United States cost a small fortune, basically. It cost a lot of money to have that thing in the United States. And so they put it in Canada because there was more money in the cost of the health care than in the cost of the steel. And so here he says, this is such an amazing phrase. He's describing these health insurance companies. Keep in mind, the health insurance companies don't provide any medical services whatsoever. They will not vaccinate your child. They will not take out your appendix. They will not, bandage your cuts. They will not fix a broken arm. All they will do is take your money, skim a bunch off the top, typically around 20%, and pass along the rest to your doctor or your pharmacy or your hospital or whatever it may be. So Wendell Potter describes them as the tapeworm of the American economic system. This is another consultant, healthcare consultant, a fellow by the name of Munger. He says the massive amounts of excess cost in the current U.S. healthcare system, which he described as a Rube Goldberg system that arose by accident. Well, it wasn't quite accident. I mean, it was in some parts, in some ways, a response to the World War II and all that. Is his reason for supporting single payer. PricewaterhouseCoopers has weighed in on this. They say the growing cost of medical costs in the employer insurance market are going to grow 2.6% next, or 6.5% next year. And by way of comparison, the consumer price index is going up a little more than 1%, 1.7%. So medical costs are tripled. They're growing 3 times faster than the cost of everything else, even when we have this low inflation rate, thanks to the Fed just, messing with our money supply, as it were. So as Buffett and Munger made their public declarations of support for single-payer systems, several like-minded business executives were forming, and this is amazing. I mean, this is, just keep in mind, just a few years ago, a public option was a bridge too far. Oh, let's let some people buy into Medicare. Now it's like, let's give everybody Medicare, right? And so anyway, and of course business executives and everybody, now they've created this organization called Business Leaders Transforming Healthcare. And the ultimate goal, they say, is single-payer healthcare in the United States. Richard Master, who is the CEO of a company called MCS Industries, which is the largest manufacturer of wall and poster frames in the United States. He founded this group after years of double-digit rate increases in his company's health insurance. And he said the biggest drivers of those were the prescription drugs. And he says, in fact, the cost of treating just 2 of his employees for Hep C was more than $260,000. And by the way, these are drugs that you and I paid to develop, by and large. You know, the individual drug companies, they'll tweak a drug a little bit here and there. But the actual development of the drugs, the new families, the new categories, that's called basic research, generally speaking. I mean, it's not just raw R&D. It's like basic research. It's like thinking completely out of the box. You know what? We had penicillin. Well, we figured out that mold, because the Native Americans used to, well, actually even old, the European shaman, and the so-called witches or midwives, and there were, depending on your perspective, whether you were the Catholic Church or whether you were having your life saved, the knowledge was there that if you took some moldy bread and put it on a wound, that the infection didn't happen, right? So they knew about the mold and the penicillin, but then somebody thought, well, what about bacteria as a source of an antibiotic, right? And that got us all those drugs that end with acillin, amoxicillin and whatnot, or maybe it's the mycins. Yeah, it's the mycin, like streptomycin, neomycin. All those come from, I believe, bacteria rather than mold. So we've got multiple sources out there. So to think of a whole new way to do this, well, gee, might there be some new kind of, something that can be used, that can be turned into a useful drug? That's not the kind of work, generally speaking, that drug companies do. Some of the new, the startup companies do, especially if they've got something they think is really hot. But most of that is funded by the National Institutes of the National Institutes of Health, and paid for with your and my tax dollars. And much of it is done at universities. They run the money into the universities do the research, and then, and then it goes out to, and then the drug companies end up with it. I mean, this is how bizarre our laws are around this. Look at, Heather, what's her name, Joe Manchin's daughter, who runs the company that makes EpiPen, Heather Bresch, that she's, I mean, they're able to take a product that was literally developed in 1890. The epinephrine or epinephrine, I think it's pronounced epinephrine. The drug, it's an analog of adrenaline that you give somebody if they're having an anaphylactic reaction, an allergic reaction, and you give them the shot so that if they get a bee sting or eat some peanuts or something, they don't, their throat doesn't close up and they don't die. That drug was developed in 1890. The system for injecting that drug automatically that makes an EpiPen was developed by the U.S. military for use in field hospitals, as typically for morphine injection, for painkiller. For somebody gets a shot with a bullet, bang, okay, you're going to feel better soon. And they didn't have to go through all the whole song and dance of finding, and storing it and whatnot. It was a wonderful invention. But how did her company end up with this? And how did they end up the sole supplier? And so that they could take the product that cost them, pennies worth of the drug. I mean, literally pennies worth of the drug. And probably less than $1 or so for the injection mechanism, and sell it for what, $500, $600? I mean, these are the symptoms of a badly broken system, a system that we need to fix, and we need to get about fixing it right now.